Did you know there's a deadly threat hiding inside your body right now? One that doesn't show itself in the mirror or on the scale. Shocking, isn't it? This silent killer, known as visceral fat, is quietly sabotaging your health from the inside out. Unlike the fat you pinch, this type of fat wraps around your vital organs, silently increasing your risk of heart attacks, diabetes, and even cancer. Here's the kicker. You might feel perfectly fine while it's slowly damaging your body. What if everything you thought about fat was wrong? Thin people aren't safe, and those regular workouts might not be enough to stop this silent assassin. But don't worry, you're about to uncover the truth about visceral fat. Together, we'll explore its hidden dangers and how it's quietly affecting your heart, brain, and overall well-being. Ready to learn how to protect yourself before it's too late? Let's dive in. Visceral fat is often misunderstood, lurking deep within the body where it's not immediately visible. Unlike the fat you can pinch under your skin, known as subcutaneous fat, visceral fat wraps itself around vital organs like the liver, pancreas, and intestines. This is what makes it so dangerous. Think of it as the body's secret storage room, except it's not holding treasures, it's hiding risks. Imagine wearing an internal weight belt that squeezes your organs 24/7. That's visceral fat. Now, why should you care? Well, this isn't just about aesthetics. Even if you look thin on the outside, you could be harboring this silent killer. Yes, skinny people aren't exempt. This type of fat is metabolically active, meaning it sends harmful signals throughout your body, disrupting your health in ways you can't immediately feel. Ever wondered why some people develop health issues despite being fit? Visceral fat is often the culprit. And trust me, its dangers don't stop here. They only grow as we dive deeper. Visceral fat has earned its ominous nickname, the silent killer, because it operates quietly, without obvious symptoms. Unlike a sprained ankle or a headache that demands your attention, visceral fat stays hidden, slowly wreaking havoc on your health. You can't see it or feel it, which makes it easy to ignore. But make no mistake, this fat is far from harmless. It's linked to life-threatening conditions like heart attacks, strokes, and even some cancers. It's like having an invisible enemy attacking your body from the inside. The scariest part? You might not even know it's there until it's too late. You could be going about your day feeling fine, while this fat is steadily increasing your risk of chronic diseases. It's like a time bomb ticking away in the background. Even those who exercise regularly or eat what they consider a healthy diet aren't necessarily safe. It doesn't discriminate, and it doesn't announce its presence. The question isn't whether it's dangerous, it's just how dangerous. And if that doesn't make you sit up and take notice, wait until we explore its connection to your heart. When it comes to your heart, visceral fat doesn't play nice. This dangerous fat produces inflammatory chemicals that wreak havoc on your cardiovascular system. Think of it as an intruder sabotaging your body's most vital engine. It raises your blood pressure, disrupts cholesterol levels, and narrows your arteries, paving the way for heart disease. Have you ever heard of someone having a heart attack out of the blue? Often, visceral fat is the unseen culprit behind those shocking stories. But here's the kicker. It doesn't just stop with clogging arteries. Visceral fat actively releases hormones that throw your entire body into chaos, making your heart work harder than it should. Imagine trying to sprint with a backpack full of bricks. That's your heart's daily struggle if visceral fat is in play. And while we often think of heart disease as an older person's problem, this fat can start its damage much earlier. Ready to uncover its link to another silent threat? Let's talk about diabetes. Visceral fat is a master of disruption, and one of its favorite targets is your body's insulin sensitivity. This fat interferes with how insulin works, leading to a condition called insulin resistance. Picture this. Your body tries to process sugar, but visceral fat gets in the way, leaving glucose to build up in your bloodstream. Over time, this silent sabotage often develops into type 2 diabetes. That's why people with high levels of visceral fat are far more likely to face this chronic condition. But here's what's even more alarming. You don't need to be overweight to have visceral fat-related diabetes risks. Even those who appear fit can struggle with this internal imbalance. The symptoms sneak up: frequent thirst, fatigue, and unexplained weight changes, and by the time you notice, significant damage could already be done. This isn't just about blood sugar, it's a domino effect that impacts your entire system. And speaking of systemic issues, visceral fat's role in chronic inflammation is a story you can't afford to miss. Visceral fat is like a factory constantly churning out inflammatory chemicals that your body doesn't need. This type of fat releases cytokines, which are essentially your body's distress signals gone haywire. Instead of solving problems, they create them, fueling chronic inflammation that affects nearly every system in your body. Think about it. Your immune system is on high alert, fighting a phantom enemy, and in the process, it starts to attack healthy tissues. Over time, this can lead to a host of issues, from arthritis to heart disease. The effects of chronic inflammation don't stop there. It weakens your body's ability to repair itself and opens the door to diseases you wouldn't normally associate with fat, like Alzheimer's or even depression. Imagine constantly running a car engine at full throttle. Eventually, something's going to break. That's what visceral fat does to your body. The worst part? This inflammation isn't just a side effect. It's a central player in how visceral fat causes damage. And the strain doesn't stop with inflammation, it stretches to your vital organs, as we'll uncover next. Visceral fat doesn't just sit idly, it actively attacks your vital organs. By wrapping itself around your liver, kidneys, and pancreas, it puts these essential players under constant stress. This fat isn't passive, it releases harmful substances directly into the bloodstream, overloading your liver with toxins and increasing your risk of fatty liver disease. Imagine trying to breathe with a heavy weight pressing down on your chest all the time. That's what your organs experience when visceral fat takes hold. The kidneys and pancreas aren't spared either. The pressure from this fat can impair kidney function and disrupt the pancreas's ability to regulate blood sugar, contributing to diabetes and other chronic conditions. It's like placing your organs in a pressure cooker with no relief in sight. And remember, this isn't just a theoretical risk. Studies show that visceral fat significantly raises the likelihood of these problems. But the body doesn't work in isolation, and the damage doesn't stop with the organs. Curious about how it affects your brain? Let's explore that next. Visceral fat isn't just a physical burden, it's a mental one too. Studies have shown a clear link between this dangerous fat and cognitive decline. How does it work? Well, visceral fat triggers chronic inflammation, which can disrupt the delicate blood-brain barrier, allowing harmful substances to reach your brain. Over time, this can impair memory, slow down thinking, and even increase the risk of Alzheimer's disease. Think of your brain as a high-performance engine. When visceral fat is in the mix, it's like pouring sludge into that engine. But it doesn't stop there. The hormones released by visceral fat can interfere with neurotransmitter balance, which may lead to mood disorders like depression and anxiety. Imagine struggling to remember a loved one's birthday or feeling persistently off for no clear reason. That's how visceral fat can creep into your mental health. This isn't just about staying sharp, it's about preserving your quality of life. And while the brain may seem like the final frontier, visceral fat's influence stretches even further, impacting your risk of cancer and other serious diseases. Visceral fat doesn't just increase your risk of heart disease and diabetes, it's also been linked to higher rates of cancer. This hidden fat produces inflammatory chemicals that create an environment where abnormal cells can thrive. For example, studies have found a strong connection between visceral fat and cancers like colorectal, breast, and pancreatic. It's like giving cancer cells the perfect breeding ground while you remain unaware of the danger lurking inside. And it's not just cancer. The inflammatory and hormonal effects of visceral fat contribute to conditions like kidney disease, respiratory problems, and even autoimmune disorders. It's as if this fat has a ripple effect, touching every system in your body. The scariest part? You might not feel sick at first, but by the time symptoms emerge, the damage could already be severe. Recognizing the warning signs early could save your life, which brings us to a crucial discussion: how to spot visceral fat before it's too late. Spotting visceral fat isn't as straightforward as pinching your waistline. You could have a normal BMI and still harbor this silent killer. One of the most telling signs is an expanding waistline, even if your overall weight doesn't seem to change. For men, a waist circumference over 40 inches, and for women, over 35 inches, could be a red flag. But it's not just about measurements. Symptoms like constant fatigue, high blood pressure, and difficulty managing blood sugar levels might signal an underlying issue. So, what can you do about it? Start by getting a professional assessment, like a DEXA scan or an MRI, to measure your visceral fat levels accurately. Pay attention to subtle changes in your energy, digestion, or even mental clarity. These can all be clues that visceral fat is taking its toll. Early detection is key because once the damage begins, reversing it takes more than just willpower. And if you think identifying the problem is half the battle, wait until you hear about the steps you can take to fight back. Tackling visceral fat isn't about quick fixes. It's about sustainable changes that target this hidden danger at its core. First, focus on your diet. Reduce refined carbs and sugars, which fuel visceral fat growth, and instead load up on whole foods like leafy greens, lean proteins, and healthy fats. Consider adopting intermittent fasting or a Mediterranean diet, both proven to help reduce visceral fat levels. It's not about starving yourself, it's about feeding your body what it really needs. Next, prioritize movement. High-intensity interval training, HIIT, and strength exercises are particularly effective at burning visceral fat. Even a brisk 30-minute walk daily can make a difference over time. Stress management is another overlooked weapon. Chronic stress leads to elevated cortisol, which encourages visceral fat storage. Incorporate mindfulness practices like yoga or meditation into your routine to keep stress in check. And here's a bonus: improving sleep quality can amplify your efforts. These steps aren't just about looking good, they're about reclaiming your health and reducing deadly risks. Now that you know the deadly effects of visceral fat, the real question is, what will you do about it? Will you let this silent killer continue its quiet attack on your body, or will you take control today? Change isn't easy, but neither is living with heart disease, diabetes, or memory loss caused by this dangerous fat. The choice is yours. Imagine a life where you wake up feeling lighter, healthier, and full of energy. What's stopping you from making that a reality? Don't let this knowledge sit idle. Start applying it today. What changes will you make to your diet? How will you move more or stress less? Let us know in the comments below. And hey, if you want to keep learning life-changing truths like this, hit that subscribe button and turn on notifications. There's so much more to uncover, and we're here to guide you every step of the way. Your health deserves it. Don't wait.